so that you use this for
standing before you, right, is Samkelsile, and I'm part of a group called Medi-point, right? So this is we started this group because of the hackathon at Richfield, and we've gotten an idea of actually going forward with it, because as much as it impacted us in the hackathon competition, it could initially help us in real life, you see. So, about Medi-point, right? So, without reading there, I can give you a summary of what Medi-point is. At this current moment, Medi-point is actually a web application, but in due time and with all the resources that we need, we might and we want to and we hope and wish to make it an application. Right? So what happens with Medi-point? It is initially an application that is used by healthcare services or healthcare facilities. What it does is it allows you to get appointments. You can make your appointment virtually. You can besides it having a virtual appointment maker, it also has a symptoms checker. What do I mean by a symptoms checker? I mean that when, let's say, you have a symptom of flu and you are coughing, you have a dry cough, you have a headache and a runny nose, you can go to just the way you can go to Google, but it doesn't give you that those extreme illnesses like you have kwashiorkor because your belly is big, you know. So what it does is it analyzes your symptoms, and it'll then, after analyzing your symptoms, it'll then outline all the possible illnesses that you have. But it will not start with a massive one, because it shouldn't be, the aim is not to give you a heart attack. The aim is not to say you're dying in the next 2 days. But we should be giving you a possible chance of, okay, if it's not as severe, because all symptoms go by severity, right? So if it's not as severe as the last, as number 10, we can say, okay, you might be having 1, 2, 3, right? So if they align and your symptoms are aligning to that, for you, if you feel like you're not comfortable with it, you can then head on to our to our virtual consultation. So what you do with a virtual consultation, that's another addition on Medi-point, right? So what happens is, if you're not sure as a person, you're not sure about the symptoms that you've gotten from our application, you can simply go head on to setting an appointment. So the upside to you setting an appointment is that you get to choose whether you want to go on in contact or a virtual consultation with the doctor. So you don't need to get up and at 11, if your appointment is at 11, you don't have to wake up and head on to your nearest clinic or wherever clinic it has led you to, right? That is our third characteristic of our application. Then our fourth one, what it has is, it can directly, for emergencies, what it does is, it can take you to the nearest, if let's say you have an accident right here, it can direct you to, it takes you straight, or an ambulance, if there's an ambulance on its way, the ambulance does not head, it goes to the nearest hospital that you have. But one thing that you need to know about our application is that it's not private, it's actually public. So you can go to Baragwanath Hospital, you can go to any other public hospital that you get. So another thing is, if the hospital doesn't have, your nearest hospital doesn't have space, whether the emergency room is full or whatever, what our app does is it'll initially notify the ambulance that, okay, this clinic is actually full, this hospital is full, so the nearest one that you can go to is this other one, you see. So that's how our app would generally work on a normal basis, and it's available to any other person. Another feature that we are currently actually working on and still working on is that it's going to have, this feature is only going to be available for a person that works in that healthcare facility. So with you as the person who is, a resident, or who is someone who wants to get help from the hospital, you will not have the feature on your app. So when you log onto the app, the first thing that it's going to ask you is, are you a doctor, a nurse, or are you a patient, right? So you as a patient, you're going to say you're a patient, it will not have a certain feature. So for doctors and nurses, what it's going to do is, the feature is going to be available for doctors and nurses, or any other person that works in the medical field, right? So what it does is, it's a virtual, what's this? I'll tell you. A filing system, yes, it's a virtual filing system, excuse me. It's a virtual filing system. So the filing system, what happens is, you as a patient, all your details would be on the app. So we're going to be having it encrypted so that nobody can access the information that you have, because nobody would want to know that you have HIV, or you wouldn't want everybody to know your most sensitive or most embarrassing illness that you've gotten, right? So that's a feature that will be actually also added onto our application, and it will only be accessible, and it will only be accessed by doctors and any other medical worker. So another thing, here's the problem that we realized. So initially, when we had a plan on building this application, our main problem was actually we were looking at the amount of time